Power 93.7 WBLK. I'm Yasmin Young. This is the 2 to 6 takeover. Now, I know a lot of you are concerned, as am I, as you know, are most of us, about the coronavirus, COVID-19. And I wanted to get some information directly to you from someone who knows about this firsthand. And I've got the pleasure of having Charlene Ludlow. She's the Vice President and Chief Quality and Safety Officer at ECMC on the phone with me because, of course, Charlene, we are practicing our social distancing.
That is correct.
So let's talk about, we hear two different terms. We hear COVID-19 and coronavirus. Can you explain each of those?
Coronavirus is the virus we're talking about, and the COVID-19 is just an abbreviation for the disease it causes. Coronavirus was, the naming of this is really taking coronavirus and the disease it caused, and it started in 2019, so that's where the 19 comes in.
Got it. What do people need to know about COVID-19? There's a lot of information that's out there. Some of it is correct. Some of it might be misleading or incorrect. What should we know about it?
Well, with the COVID-19, as we're doing more and more screening in Western New York, we are going to be finding more and more cases. But the big thing to remember is 80% of the people that do contract this coronavirus are going to have a mild case, something not much more than the flu that you would see. But as we say that, there are people we have to be very concerned about. Like 12% of the people that do get infected with this coronavirus, if they have other chronic diseases, this could be much more complicated for them. And those are the people we're concerned about. They're going to require hospitalization. And as you've heard on the news and throughout the last week, we're really concerned about the number of people that may need critical care as well as medical surgical admissions to the hospitals.
Okay, so we're talking elderly people especially?
Anybody that's very severely immunocompromised. And I don't like to just go with elderly because we have people that are getting chemotherapy. We have people that have had organ transplants.
Right.
All of those type of people are on some immunosuppressive drugs. So we want to be careful with all those populations.
Got it.
So that's why it's become so important that we practice our social distancing. And that's why it's been a big issue currently, even as people are going to the grocery store and even as you're going out in public for those few things that we still have open that we can go to, we still got to be thinking about staying apart. And, of course, the most important thing is still doing hand washing frequently.
Absolutely. If someone thinks that they have been exposed or if they're feeling kind of symptomatic, what should they do?
If people are starting to feel symptomatic, number one is stay home. And then also, if you are having concerns where you're having shortness of breath or if you're getting a higher fever, you need to reach out to your primary care provider. And the primary care provider will do an assessment and determine if you need to be tested. And the primary care provider can order that and get that all set up for you. Only the people that are having, when they've talked to their primary care provider and feel that they're really having intensity of their symptoms, are the ones that the primary care providers are referring to come to an emergency department.
Got it. And you kind of touched on this, but what is the best way to limit our exposure to the coronavirus?
Well, one of the things, now we're staying away from groups, but even individually want to make sure that we are practicing good respiratory etiquette. So that's covering our cough, and that's with our arms, not with our hands. We want to make sure we're using tissues, disposing of them properly, keeping that social distancing going. And then what we are doing is trying to make sure people who are well, we don't want them wearing masks. We want to use the masks for the people that are symptomatic, and those are the people that we put a mask on if they're going to be out in public so that they're not spreading that virus to others.
Right.
And again, as I keep saying, it's hand hygiene. We can't say that often enough.
Is there a number or a website people can go if they do have questions, if maybe they have any concerns?
There's the two best ones I think out there right now are the CDC website, which is cdc.gov, and they have a whole section just on coronavirus. And the other one is the New York State Department of Health. It has a fabulous website, and they also have a hotline number. When you go on their website, you can get that hotline number, and they have a lot of frequently asked questions on there, but it also gives the history and why we're so concerned about this virus. And we just want to make sure that we get this under control quickly. One of the things, every year we do have a flu season, and we try to, get containment there. but also we want to make sure that we have people really looking at actions that they can do to make this move faster. So we don't want this lasting until June.
Absolutely. I appreciate
it.
Oh, I'm sorry.
One other website, if you're interested, many of the hospitals in the area, but ECMC does have on their website not only information about the coronavirus, but anybody coming to visit our site, we have our visitation restrictions and things listed there, which we are updating every day. Just as the events are evolving, we want to make sure we're keeping people up to date of what's going on.
Charlene, I appreciate it. Thank you so much for giving us this information and sharing with us and taking the time. We really do appreciate it.
No problem. Have a great day and wash your hands.